All right. Hello, everyone. How are we all doing? How's the hanging there? How's the SDC been for you guys? Hopefully, you're having a good time. I know there's a lot to process this year with Bixby and IoT, and you might think, well, what is health fitting in this scenario? We have a lot to talk about. I have a lot of exciting information that I would like to communicate to you, and hopefully get your support in building out some of these services. This is one of two sessions that we prepared for you for Samsung Health. Hopefully, I can raise enough interest so that you'll come back to us at 2:30 tomorrow, where Young sitting over there, he'll be going over a lot more about the SDKs that we are preparing for you. Sorry, I have a lot of cheat sheets here, so I'm going to be referring to some of the notes. My name is Jack An. I represent the strategy and R&D group for Samsung Health Service Team. And we, as Samsung Health, believe that each of our users is taking a very unique health and wellness journey, not just point in time, but throughout his or her life. And today I would like to share what we intend to do to be really accompanying that journey that our users are taking. And that's important for us, that we don't want to be transactional, and that we want to be really a true companion to our users. Today on this session, I'll be going over some of the things that, in terms of what Samsung Health has been, sort of brief history about where we came from and where we are moving toward, and more importantly, what we are planning for near and future, long-term futures. And probably the most important thing that I wanted to communicate to you all today is that how we envision developer community and us, Samsung, as well as our partners, how we can collaborate together to bring a lot of these services that we're envisioning to bear. I think, by the way, the timing is not clacking down, so I just want to make sure. Okay. So I earned about two minutes there. We are at this sort of a very interesting proverbial inflection point, I believe, in digital health. When we look at digital health, when we think about digital health, there are probably about 4 different sort of participants, influencers, or factors that are slowly converging. And the technologies, the advancements that we see in technologies, users' acceptance, the level of acceptance increasing, and also the economics and the policies that are changing around us. So we've seen a great leap of technologies in terms of sensors, wearables, smartphones becoming smarter, and that's accompanied with the users. And in this case, we define users as patients, consumers, care providers. And we've seen the level of acceptance steadily increasing. In other words, they're harnessing technologies to help them feel better, get better, recover better, exercise better. So the health lifestyle that they're trying to pursue is now being augmented or supported by technologies around us. And I think there's a lower barrier of sort of ickiness that we always felt that how much of technology is going to be helping us. In some sense, more importantly, the economics in terms of who's paying for these services. That's changing. Obviously, couple that with the policy changes that are happening around us in the US as well as globally. So we believe that the economics of who pays for the service is coupled with the policies that are being changed. And these policymakers, when we talk to some of the government officials, they are thinking digital health as a forefront of their discussions when they talk about how the policies should be changing to support some of these technological advancements. So with this converging of different factors, Samsung Health, we really want to be accompanying and being an authentic companion to our users by bringing services to the right user at the right time using the right mechanism. And that's clearly a mandate that we have for ourselves in terms of how do we define the right service that's meaningful for each individual user. And this will be a recurring theme as we look at how health, digital health, will evolve. And of course, it's important to point out that the data that we use to bring a meaningful service for a particular user is for the specific user. So in other words, we do not, and this is a company, sort of Samsung corporate-wide policy, that the data belongs to users, data belongs to you. And therefore, we do everything that we can possibly do to make sure that we protect the security, the privacy, but bring that sort of benefit to our users. So taking a quick look back at where Samsung Health came from, starting probably about 5 years ago, Samsung Health, the consumer app, started as a modest fitness tracking app. Of course, since then, we've increased both breadth and depth in terms of services and features that we added to Samsung Health. But it wasn't just simply adding features. A couple years back, we started to ask ourselves, it's great that we are providing all these numbers. How many steps you've taken, what your current heart rate tells you, how many cups of caffeine, coffees that you have taken. But those were just numbers. The question is, do we expect our users to take that number and do something with it, which was sort of conventional wisdom back then. But starting a couple years ago, we started asking ourselves, how do we make sure that we are bringing more meaningful services that's more consumable through our Samsung Health consumer app? So we start adding, for example, what we call Ask an Expert, which is a telemedicine service partnering with, in the US with American Well, in the UK with Babylon, and in India with Librate. And also we expanded that service to diabetes wellness program, collaborating with WellDoc. And starting this year, we looked at a couple of research programs and pilot that we wanted to bring to the market. One of the research program that we started was in collaboration with UCSF Medical School, specifically understanding the correlation between blood pressure and stress, and the end goal being bringing better stress management program. And also, we started a piloting of service called HeartWise, which is on the sort of cardiac rehab program that we're assisting. So I'm going to go over couple of those research programs more in detail in later this session. As wearable is taking a prominent place in our ecosystem, we at Samsung are reimagining wearable to be the central access point for services and user engagement. So I'm really excited about seeing some of the advanced work that we are doing in the wearable side, not just in terms of form factors or sensors, but being able to better engage with our consumers, with our users. And we're hoping that some of that will be rolling out very soon. And so hopefully we'll see sort of market adoption that enables users to take advantage of these technological advancements that we're making. And all this is really to our pursuit of personalizing and bringing that sort of personable, consumable services to our users. Not only the consumers, but also our enterprise B2B customers. When we look at digital health and how this is impacting our users, patients, one of the things that is obvious is that we have to be always looking at the user as a center of that universe. The user-centric health service that we need to build by designing with the user in the middle. The user-centric design is a pivotal and most important aspect of how we can bring these services that are, again, meaningful and consumable. One of the examples of what we are doing in terms of personalization and bringing that sort of touch point closer to our users is with our Galaxy Watch. So Galaxy Watch is our latest addition to the wearable family. And one of the things that we were very conscious of bringing in our Galaxy Watch are two things. One is sleep. So with Galaxy Watch, our users are able to better understand their sleep stages. There are 4 stages that we're tracking. Now, the question is, what does that really mean to the end users? I think there's a lot of education that we'll be bringing through our wearables in terms of helping our users understand what it means to be having REM sleep versus deep sleep. And understanding the quality of their sleep, then we can augment that with services that will help them better manage their sleep quality. So the measurement is there in our watches now. The service that we'll be incorporating will be available in the next 3 months or so. Another example is stress. As I mentioned with UCSF research program, we have our sort of own algorithm in terms of analyzing the stress level. And so in this watch, Galaxy Watch, we have a feature that you can continuously measure and monitor your stress. And of course, the second half of the question is, what do you do with that number, with that measurement? And that's where we're so excited to bring this new service in, I would say, within the next 3 months to the market, where we are incorporating sort of mindfulness aspect of service to our wearable into the smartphones that we have. I think it was the Ernst & Young report, one of the reports stated that now humans, we are the biggest data platform. And I would like to add to that, I think we are surrounded by data. The data that we generate every day, genomic data that we carry, environment data, social determinant, and population data. The question is, how do we harness the dizzying array of data? And we believe that, at Samsung, that building a robust platform for this 360 degree of health data that can empower our users to see the insights and act on it and close that feedback loop. And I think that's where the power of data will come alive. And we're really excited about today talking with you about how we are envisioning and what we are planning to build that out with your help and with your support. One of the examples of I would say very small examples of personalizing is what we call Discover Plus, which is part of our Samsung Health app 6.0. We believe that this is a viable platform of choice where consolidation and personalization of contents, programs, and health and fitness and wellness related products and services can come alive and easily discoverable. And so therefore, the users are not hunting for information. They're given information that's relevant to them at the right point. For the next few slides, I would like to sort of go over a little more in detail about what we are doing, a lot of research programs and pilots that we're running. And you might be kind of wondering, what are all these research programs and why so many pilots? Turns out, and this is one of those learning experience lessons that we learn, a lot of these services, as we touch on that sort of borderline of a clinical and non-clinical, there has to be evidence that this service work. We can't just sort of deploy a service and here you go, consumers, go use it. Trackers might work that way, but we're finding more and more that the consumers, as they become more aware of what technologies are doing, they are asking, what is your evidence? What is your evidence that this service is working for me? So that's why we have a lot of research programs and pilots that are running in concurrent fashion. One of which that I wanted to dive into is our collaboration with UCSF Medical School. This research program was launched early this year, February this year. And this was made possible with the special sensor that we put in our S9 and Note 9 and on. And that using this sensor, it is possible to measure your blood pressure. We don't say it's a sensor for blood pressure because it really isn't, but turns out the sensor is capable enough to actually measure blood pressure. That's comparable with cuffs and conventional measuring tools. So really the key thing here is that the folks at UCSF, they're trying to correlate the blood pressure with the stress level. Now, I'm learning as we go through this research program that stress, there's some good stress and there's some bad stress. The question is, how do you determine what's good and what's bad? And therefore, before the user get into that bad stress stage, how do we help them getting out of that? So in managing the stress better. Since we launched this in the U.S., we've seen an increased participants in this program, and we are soon rolling this out to other parts of the world. And this will be continuing on, and the data that we collect here obviously will help us refining our algorithm, but also we'll be using this data for our pre-certificate, FDA pre-certificate program. Another pilot that we're running with one of the largest care provider in the U.S., we call it HeartWise. The reason why we call it HeartWise is that this is meant to be assist the cardiac surgery rehab programs. So we took a very small portion of that rehab program on exercise and monitoring. Now, why is that? Because part of the rehabilitation from cardiac episode and surgery is getting their heart rate to a certain level and maintaining that. And that's an indication that the patient is recovering. Using our wearable and app running on wearable and phone apps, our patients are able to follow their tailored rehab program in the comfort and convenience of their home or any place of their choosing. Now, up to this point, what was happening was that the patients will have to drive to a facility where they can do the rehab for 20, 30 minutes with nurse or case manager next to him or her. Obviously, depending on where you are, you might be driving for an hour for that 30-minute exercise and coming back. The question really is, it's not about the traveling time, those sort of inconveniences, but the real the black hole is that once the patient is out of that facility, how do we know? How does the case manager, how does the nurses know that this patient is exercising and maintaining certain regimen? So with wearable, we're continuously monitoring, and that information is being transmitted to the clinician's dashboard. So imagine conventionally one case manager or one nurse being able to pay attention to one patient. Now with virtual solution in place, one case manager, one nurse can literally monitor tens and hundreds of patients. But it's not about efficiency. This is about patients getting better. And we've seen with this program in place, the completion rate has almost doubled. So doubling meaning the conventional way of rehab program, most people drop out. So it's a 7 to 8 week program. People drop out in the middle. Sometimes they feel, well, it's not necessary. I feel good enough. So we've seen almost a double of that completion rate. But more importantly, the satisfaction rate of coming from the patients because the technology is helping them. And this clearly indicated to us that if we apply technology in the right way, appropriately, it does impact positive way. And this is the biggest lesson that we learned, that technology for the sake of technology is going to go nowhere. Technology that helps people in a meaningful way is going to be adopted and utilized. One of the areas that we looked at in terms of our enterprise strategy was looking at and teaming up with insurance industry leaders. Now, you may think insurance, that's, how is a wearable going to help insurance industry? Turns out insurance industries are at the moment of sort of breaking through using technologies. They want to be more relevant with their consumers, with their policyholders. consumers, obviously, they want to lead a healthy lifestyle, and they want a feedback. They want some actionable insights that will help them leading their lifestyle. So kind of marrying those two needs, we're providing wearable-based service where we're going to be providing, and I say we're going to because this is going to be launching in April timeframe. We're going to be providing very understandable, approachable health indexes that will help our users understand how they are doing on a daily basis. And as a added bonus, how that impacts, for example, their life insurance coverage. So this is a part of our strategy and industry's needs for engaging with their users in a much more intimate way, much more close way, much more dynamic way of introducing their insurance program. But the benefit that we're trying to communicate to our users is that this is going to be non-invasive. Just you wear it. It's going to be telling you what's going on, how you're doing on a daily basis, and giving you that right information at the right time with the insight that they can try to improve whatever aspect of they are focusing on, whether it's a better sleep, better stress management, better fitness, better activity. So this is one of what I believe is an interesting way of looking at technologies and bridging the gap between the traditional, more transaction-based enterprise business to consumers' needs. A couple of things I wanted to quickly touch on. One of the, again, this is a pilot program that we're running in the city of Leeds in the UK. ActiveAge is a program that's commissioned by the European Union and all around the elderly lifestyle. So there are 9 sort of pillars of elderly lifestyle management that the EU has commissioned. And Samsung is taking the lead on using wearable-based fall detection and monitoring service. So we put an algorithm in our wearable that can detect fall in a very reliable way. And so this in pilots starting about February this year. And we'll be expanding this service to different parts of the UK. The reason why we're starting with the UK is obviously that's where the pilot started, but because of their sort of policies and government policies, it's actually much more adaptable in terms of where we start the pilot, and that evidence can be easily translated into different parts of the UK. I think what's important to notice is that the fall detection based on wearable is an incredibly difficult endeavor, and obviously we failed many times, and we feel that we reached a point where we can actually commercialize this algorithm. So we're really excited to bring this through the pilot and to the market, probably looking at 2019. But these are some of the things that hopefully you will hear through different channels. The last thing I wanted to kind of touch on, this is in a design phase where we're looking at corporate wellness from 2 distinct aspects. One is empowering employees to lead healthy lifestyle, and the other one is workplace safety. So obviously, wearables they can assist in that area. We wanted to make sure that we are bringing the right service to the market that doesn't get lost in sort of the wave of corporate wellness technologies. So all this to say is that the service that I mentioned, the pilots that we are running, the research programs that we are participating and collaborating, really what powers them is data. And I think this is where developer community and us and partners can really work together and collaborate. We already have SDKs that enable application-to-application data exchange, device-to-application, and server-to-server data exchange. What's really exciting is that, and this is going to be the topic of tomorrow 2:30 session, is that we are introducing a couple more SDKs that enables wearable apps to wearable app data exchange. And also the web services to app integration. And that's not just a data exchange, but it's a content exchange that will enable our enterprise customers, for example, seamlessly provide their service through our Samsung Health consumer app. And again, this is going to be the key topic of tomorrow's 2:30 session. This is what I'm really excited about. Enabling our users to not only access their medical data, but also utilizing that in a more meaningful way. So we've been at the drawing board for a long time this year, and we finally we feel that we have the right strategy and the right sort of methodology to really harness this medical data for the benefit of our users. And also we feel that it'll be necessary, and it is obviously technically feasible, to enable our Samsung Health data using standards such as FHIR. And so that's in the works. And in fact, I think I have a demo that I would like to show you just quickly. I have two demos, and first demo I'm going to be using the big screen here, and second one I'm going to be using our Flipboard just to make sure that it works there. Let me see if I can switch to two. So hopefully you can see this. So this environment you're seeing is called Samsung DeX. And this is an incredibly immersive environment where you can plug in your phone, and it gives you a desktop experience. So anyhow, what you're seeing here is our let me see if I can actually interact with. Okay, so I'm going to use a mouse to show you. So what you see here is that the data that we pull from FHIR server, this happens to be Cerner server, the test server that we're using, and there are what they call 10 resources that are available for us to pull in. I'm showing you about 5 or 6 here. So if we look at, let's say, a care plan, and this, again, this is very sort of conceptual model that we're working with. So it has some information about the care plan or the observation or the medication. So assuming this, this data set grows, what we were thinking was, well, how do we really make this meaningful by being able to share, for example? So sharing means, okay, this is where I'm going to fail because I don't have a keyboard attached to it. But anyway, so let me, I'll show you this on this one better because I can do the touch screen here. So imagine I want to share this with my primary doctor. Maybe this is an information about my heart specialist data. And I can, in this case, we're using secure email, but you type in the email address, and this goes into my primary doctor's email inbox. He or she opens it up, and it'll give a link that's actually time-bound. So it's a temporary link that's available for whatever configuration that we choose to, and the person will be able to use the exact same data that I see. And so therefore, it makes the communication of the information much more seamless. And so with just leap of faith, and let me switch over to this Flipboard here. And again, hopefully this will work. All right. It worked. It worked. I'm so happy. Whew, thank you. Thank you. Okay, so let me show you quickly what I meant by sharing. So let's say I want to share this with my doctor, and I'm going to pretend to be a doctor. Yahoo.com. And say OK. Okay, so then what would happen is that I go to my Let me see. Oops, sorry. That's not it. Okay. So I go to my email inbox. And then here I see link. Again, we'll need to verify it, but this link is going to be a temporary link, almost like a Snapchat, Snapchat type of link, where you see the exact same data. And also, the one of the things I wanted to show you was, so I put this in our secure folder. You'll see my passcode. I'll remember to change that later. So this one is actually, just presenting this data is interesting in its way, but again, is demanding a lot for users to now, look through and see what's going on. So one of the things that we're looking at is being able to consolidate this. And in this example, we are sort of using sort of a chronological order of what's going on in terms of all the sort of tests they've run, the medication they have been taking. And as you click in, here this is more text, but imagine this to be more interactive, more sort of videos and tutorials in terms of helping them understand what does this number mean. So blood pressure, the systolic and diastolic, what does that really mean? And what does it mean? And the reason why we have this scaling scale is that we're going to be able to, again, I'm kind of hand waving, but as I move this around, this will change to tell you how to get there. If it is about lowering my blood pressure or the stress level or the my glucose level, this will be sort of more interactive from the user perspective and the patient's perspective. And this is where we believe the true power of being able to get access to the data, but utilizing the data. And again, not forcing users to look at the data and then interpret and try to make sense of it, but giving them the insight that why this matters to them. So that's a quick demo. Then let me jump back to, there we are already. So I have about 30 seconds, but so our vision is to build this 360-degree of health data platform with your help and with our partners' help, because this is not something that we can build out on our own. But what's more important is that we need to build on top of that the meaningful insights that's easily consumable to our users. And insight doesn't mean notifications. That's sort of annoying notifications. They're telling you obvious facts, but we're talking about the information that becomes a knowledge. That knowledge gives you power to do something about it. And this insight, I believe, will enable us to build more meaningful, more consumable services in digital health. So we're in a very pivotal point in time where a lot of these factors are slowly converging. And I think we're at that pivotal moment of being able to really utilize technologies to bring services that are meaningful to our users. So I earnestly urge you to join us in building meaningful services that serve billions of people in health, and fitness, and wellness. I want to thank you for your time, and I'll pause there and I'll open up for questions and comments. And thank you. Thank you. Yes, sir.
Hi, this is great. I love what you're doing.
Thank you.
It's the future. I'm with you on that. Two questions. The first is a lot of healthcare providers, hospitals and whatnot, have antiquated or inadequate IT already, and so they may not be able to easily or at all connect with this. Have you taken that into consideration and thought about how to level them up? And maybe I'll even shoot my second question so that you can get to it, which is I really want to know more about how you detect stress, if you can talk about that. So those are my two questions.
All right, great. Let me address the first question. Absolutely right. We look at some of the challenges of bringing new technologies to existing infrastructure is perhaps technology aspect, but also the workflow. If we try to bring, for example, HeartWise to our clinician world, we have to understand what they do, how they engage with the patients. Therefore, we can inject this service as part of their workflow, not as one-off thing that now they have to do something different to utilize this service. So by the same token, we have to understand what is the infrastructure they have and what part of that is able and available for integration or replacement. And that's really a part of the challenge that we are working closely with care providers, for example, understanding their IT infrastructure to see how this new service can be sort of slide into it. So not as a sort of additional hardware or infrastructure they have to build and then put things around. I think that's the power of this mobile that's giving us, in some sense, this becoming more of an agent of the change. So by now, most of enterprises, most of IT infrastructures are acting with mobile phones or smartphones. This can become the change agent for perhaps slowly, maybe not replacing, but introducing services that are meaningful. So again, this is a case by case. We look at some of the largest hospitals, and they've begun this revamping 10 years ago, so they're ready. We go to some other hospitals and care providers, they're just starting now. They're starting just now to sort of consolidate their EMR system to be one vendor system, from 3, 4, 5 different systems. So it's a slow moving, but I think with technologies that mobile technologies that we can help them get there faster, but not by demanding new things, but understanding how we can work with them. The second question about how do we measure stress, and so that's where sort of my knowledge stops. Obviously this is based on algorithms and incredible array of data that we have processed and analyzed for last couple of years. If you're interested in that, I'll definitely get you the right people to talk about that. But at a sort of summary level, we are using HR, HRV, and the VO2 max data that's coming out of our sensors to kind of aggregate that information to reflect the stress level. Although it always tells me that I have no stress, so I don't know. Maybe I have the best job. Yes.
Do you have the ability to pick up GSR, galvanic skin response, from the phone or from the watch?
And you are really testing my knowledge.
Okay, never mind. Okay. I'll follow up with you.
Yes, thank you. Any other questions, comments? Yes, sir.
When do you expect the When do you expect the PHR to be on the market?
Great question. This is really just between us. It really started as just skunk work. I knew I had to do something, but we are engaged in so many different things. But now I have attention of some of the engineering folks. So I'm hoping that we can bring this out to the market in 2019, probably second half of 2019. Now, a lot of that is about learning process. So I have begun to talk to about 6 different care providers to understand, so that the user, your patient, gets the medical data. So what problem does solve for you? Overwhelming response that I got from care provider side, the clinician side, was that it's great that patients have access to their data. However, that's only half of the sort of answer. The other half is that a lot of as the first the question alluded to, a lot of the care providers that we talk to, they are in a sort of struggle to even just do a very minimal set of integration. But this, right? Trying to integrate one system to the next system is feasible, but should you spend time and energy and money to doing that? They see this as an incredible central point where the data can come in at users' hand and being able to share that with their other part of their hospital systems. So those are the type of things that we're learning. And so therefore, when we bring out this service, we want to be a little more comprehensive than just getting the data in the hands of the patients or the users. So we're looking at probably second half of next year. Any other comments, questions, feedback? Yes, ma'am.
How are you planning to handle How are you thinking about rolling out the PHR functionality in the U.S. as opposed to Europe, as opposed to Asia or other continents?
Yes, absolutely. Great question. Turns out, like anything, this is very regional by regional. So in the U.S., because of the a great push from CMS and VA to a certain extent, FHIR has become a little more. It's gotten a little more momentum, almost a de facto standard, where Cerners and Epics of the world, they're opening the little bit of data. If we look at, for example, UK, India, Asia, for example, this is not the case, right? So rolling this out, obviously US will be, the major market that will roll this out. I'm talking with, for example, the NHS in the UK, and for example, Korea, we have a different protocol, different standard, different, regulation. So that aspect of getting data and utilizing will be almost like regional thing that we have to do. So we'll be looking at, what is the right sort of approach, where do we feel that the most, that we can serve the most? Because part of this capability is us understanding what else can we do with the data for that particular user. So that would be also the learning process.
I have more questions. I can keep going.
Yes.
Have you started thinking about with doing those different data integrations for each region, then the different kind of app ecosystems and research ecosystems that you can create? Because obviously each area has different groups of people. Absolutely.
And I think that's where I'm taking a very careful step, because when I mentioned this 360-degree of data platform, that's a very ambitious statement. When I talk with a couple of other our partners in Silicon Valley and up in Seattle, they're grappling with the same challenge. So I think this is going to be a completely collaborative effort. So that's, I would say, to be determined in terms of how wide and how deep do we go. My thought is that we need to solve small problems first that's meaningful for users. And the question is, what is that small problem that we can solve? Small but complex. Five, 4, 3, 2, 1, disappear. All right. Well, thank you so much for your time. I'm so excited that you joined us. And please, tomorrow, 2:30, you'll get to know a lot more about how to integrate with our system using our SDK. Thank you very much.